Welcome to our comprehensive guide on identifying essential medical equipment and procedures through images. In the world of healthcare, recognizing tools and understanding their uses is crucial for both students and professionals. Throughout this video, we will explore a variety of medical instruments, from airway management devices to diagnostic tools, and learn how to distinguish between them. Whether you are preparing for exams or enhancing your clinical skills, this journey will provide you with practical knowledge and visual cues to boost your confidence. Let's begin by looking at some of the most commonly encountered items in clinical practice and set the foundation for deeper understanding in the following scenes. This scene we focus on airway management devices and diagnostic instruments, which are vital in emergency and routine care. For example, the endotracheal ET tube is used to secure the airway in critical situations, while the Gettle airway helps maintain patency in unconscious patients. Diagnostic tools like the laryngoscope and otoscope allow healthcare providers to visualize the airway and ear canal, respectively. By closely examining the images, you will learn to differentiate between similar-looking devices, such as the William airway versus the Gettle airway, or a central line versus a dialysis catheter. Mastering these distinctions is essential for safe and effective patient care. Let's look at some real examples and highlight their unique features. Now let's connect these instruments to their clinical applications. For instance, a Ryle's tube is used for gastric lavage or feeding, while a colostomy bag collects waste after bowel surgery. Understanding not just the appearance but also the purpose of each item is key. We'll also touch on procedures like peritoneal dialysis and bladder irrigation, which require specific sets and careful technique. By reviewing these images and their associated uses, you'll be better prepared to identify the right tool for the right situation. This knowledge is invaluable in both emergency and routine settings, ensuring patient safety and effective intervention. As we wrap up, remember that visual recognition combined with practical understanding forms the backbone of clinical competence. Conclude, being able to identify medical equipment and understand their uses is a fundamental skill for anyone in healthcare. We've covered a range of tools and procedures, highlighting their distinguishing features and clinical significance. Remember, practice and repeated exposure to these images will reinforce your recognition skills. Whether you're preparing for exams or working in a clinical environment, this visual knowledge will serve you well. Continue to challenge yourself with new images and scenarios, and you'll find your confidence and competence growing with each step. Thank you for joining us on this educational journey. Keep learning and stay curious.